and welcome to another episode of Doc Talk Beverly Hills. Hi, Dr. Katzen. Good morning.
Hello. Good morning.
How are you doing today?
Good, thanks. How are you?
I'm wonderful, thank you. So today we're going to be talking about VASER Hi-Def liposuction.
All right.
What is that?
One of my favorite topics. So VASER is an acronym. It stands for vibration, amplification, at sound energy at resonance.
And what does that mean?
So basically it uses ultrasound, and ultrasound is a form of energy. It's a wavelength that can disrupt or shatter physical cells. So in this case, what they figured out is the wavelength that it takes to break the cell membrane of the fat cell. So basically we dial it in, we insert the probe, we turn it on, and basically the frequency that it emits basically bursts or explodes the fat cell, making liposuction much easier.
Okay, so let's explain this like we're explaining it to like a kindergartner.
Yeah.
So is this a step process or is this a type of liposuction?
This is sort of both. All right. So in traditional liposuction, we put in tumescent fluid, which basically is fluid to numb the area, to float the area, and to minimize bleeding. Okay. And then once we get our aquatic medium, our tumescent solution in there, then we come in with step 2, the liposuction, where we insert a probe like a straw and we suck out the fat and some of the tumescent solution. So that's what we call traditional liposuction. 2-step technique, tumescent solution, and then liposuction. VASER is an extra step that we put right in the middle. Okay, and the reason we do that is because with the VASER, basically it's a probe that we put in there and we turn the probe on and it melts the fat sort of like butter. Okay, so we put the probe in and the probe, it sends energy and it basically melts the butter so we can come in with our third step, the liposuction, and suck out that fat easier. So it's just a step to make the liposuction easier.
It sounds like it's a smoother process for the body.
Yeah, a much smoother process. It does a couple things. The VASER is known to minimize bleeding, maximize results because it's melting the fat, and one of my favorites is it heats the skin. It actually heats the skin from underneath, and whenever you heat the skin, it contracts. All right, so yeah, in my opinion, the VASER is sort of the best technique to help skin contracture on the top.
And what are things that you could do with VASER liposuction?
Yeah, there are a lot of things you can do. Basically, VASER liposuction is great for revision. If you had liposuction done before and you need more liposuction or liposuction of certain areas that have scar tissue, it's ideal. Liposuction with the VASER is really good on the back because the back has a lot of thick septi or thick adhesions of connective tissue on the back, which you can aspirate much better with the VASER than with traditional liposuction. And then the VASER can also be used to sculpt out the muscles. So typically we're sculpting out the muscles on the tummy or sometimes the arms. Those are 2 classic areas we use the VASER for.
How do you do that? Sculpt up the muscle?
Yeah, basically we go in with the tumescent solution, we put in the fluid, we let it float. Then I go in with the VASER and preoperatively I've marked out the patient, exactly where all the muscles are, the muscles insertion, the muscle shape, the muscle bellies. And then I go in and I can feel the muscle with the VASER and I melt the fat around that muscle. So we basically just bring all the fat down and shrink wrap it around that muscle with the VASER. And then we come in with the liposuction and then we suck out the fat that's been melted by the VASER.
So is everyone a candidate for VASER Hi-Def liposuction?
Almost anybody. You know, you've got to be healthy for the surgery. And before surgery, we're going to order blood, EKG, chest x-ray, urine, everything like that to make sure you're healthy for the surgery. But barring that, most people are candidates for liposuction and VASER liposuction. Ideally, you shouldn't be too overweight, but with the liposuction technique, we can remove the fat, and then the VASER can also chisel some of those muscles out.
What about for the muscle sculpting? And is it also called muscle sculpture? Yeah,
there are multiple names for this. People call it ab etching. Okay, we're etching out the abdominal muscles. But with the ab etching, there's no mention of the VASER. So some people do ab etching just with traditional liposuction, and in my opinion, you don't get as good results. So I prefer to call it VASER high definition liposuction. All right. Some people also call it liposculpture. Okay, you're sculpting out with lipo. But also with liposuction, aren't you sculpting anyway with liposuction? So there are all these different names for the same procedure. I call it VASER Hi-Def liposuction.
Okay, yeah, so I was wondering if anyone can qualify for the muscle sculpting no matter how big you are.
Almost anybody. The quality of the results really depend on, one, the patient's anatomy, and two, the way the procedure's performed, and then three, their healing. So if you're overweight and have a lot of skin or have a lot of stretch marks, maybe you've lost a lot of weight, maybe that skin's not going to bounce back. Maybe that skin's not going to shrink wrap the way we want it to with the VASER. So in those patients may be better served with perhaps a tummy tuck, and then secondarily, maybe 6 to 8 months later, we come back with the VASER Hi-Def and then sculpt out the six-pack muscle on top of that tummy tuck. That really works well too.
Oh, okay, gotcha. And not only do you use the VASER machine for liposuction, but you also use it to remove silicone sometimes.
Oh yeah, very, very good. So yeah, the VASER basically is just a tool, and when I'm removing silicone, the silicone really gets trapped in a lot of scar tissue. So one of the benefits of the VASER is that it melts the scar tissue around these cavities. So no other machine really does that except the VASER. So I use the VASER to melt that scar tissue around the silicone, allowing access to the silicone, so then I can remove it with
and
the
sorry,
suction.
just to specify, this is silicone injections.
Yeah, silicone injections, not silicone implants. Illegal silicone injections, correct, yeah.
Yeah, and this works, and you know it works because, one, your patients feel instant results after the surgery, and two, when we're looking through the specimen that you resect, there's actually the silicone balls in there.
So you can see the videos, of the aspirate, the stuff I removed from the patient's body. There is silicone there. You can see the silicomas, the silicone balls, the bobas, and the leaked silicone. And then two, when I consult with my patients after the surgery, there is significant relief from the procedure. So we know clinically it works, the patient feels better, and anatomically it works because there's physical removal of the product.
So you love the VASER machine, huh?
Yeah, I think it's very good. I've owned a VASER machine ever since about year 2000. So I've had the machine for about 22 years, many additions and versions of the machine, but it's a very good machine.
And what is the difference between VASER and laser?
Yeah, so basically the VASER machine, again, uses sound energy to melt the fat. The laser is a different type of suction machine. Basically, there's a little tiny laser at the end of the suction machine. You turn off the lights in the operating room, and you can see the little light at the end of the probe. So that's pretty much it. It doesn't really heat the skin with the amount that the VASER does. It doesn't use sound energy to melt the fat. So in my opinion, I think the VASER is a much better product than the laser liposuction.
Okay, and how often are you performing VASER Hi-Def liposuction compared to traditional liposuction?
Compared to traditional liposuction, I perform VASER probably 95% more than traditional liposuction because I think it's just a much better tool. There are very few contraindications. There are very few reasons why we shouldn't use the VASER.
Is it more expensive than traditional?
Slightly more, but again, you should be focused on the results, not necessarily bargaining for the cost.
VASER does give you optimal results, and being that it helps your skin to tighten up a little bit, that's another huge benefit, right?
Yeah.
Especially for as you get older and your skin gets more stretchy.
Yeah, so it doesn't contract as well as you did when you were 20. So yeah, the VASER is I think the optimal tool if you're going to do liposuction. It really helps that skin to contract.
And can we get an idea of if we need a BMI requirement for this procedure?
Yeah, BMI is important, but it's not sort of the end-all number that tells us everything about your medical history. So more important is your medical history. Do you have diabetes? Do you have heart problems? Do you have problems going up and down a flight of stairs? Things like that, rather than one solitary number of a BMI. It is nice to have your BMI less than 30, but not all my patients have a BMI less than 30, and we're performing successful liposuction procedures.
We should also talk about what will happen if you have a lot of excess skin and you want liposuction, because some people might think that's going to be the cure for their excess skin.
Yeah, so liposuction is ideal for patients with isolated pockets of fat with, very important, with good skin quality. So that skin quality should be no stretch marks, no significant weight loss more than 100 pounds, etc., and ideally age less than 40. Okay, so those are sort of the ideal candidates. If you have any other of those, maybe you have some muscle weakness, maybe the tummy sticks out, maybe you have a lot of excess skin, maybe you have stretch marks, those patients may be better served with a tummy tuck, which is a different kind of procedure. So again, liposuction, as the name implies, is just removing fat. We're hoping and relying on the technology and some of your anatomy and physiology for the skin to shrink wrap around it, but the primary focus of the surgery is removal of fat. Not really a skin surgery, it's a fat surgery.
Can you talk about why you can't really combine a tummy tuck with liposuction of the abdomen?
Yeah, so basically when we're doing a tummy tuck, the blood supply comes from above. It comes from the upper rib cage and the sternum and the sides of the ribs. So if we do liposuction in the anterior abdominal wall, it can compromise the blood supply. So sometimes you hear about dead skin and ischemic flaps and necrotic flaps on the tummy tuck. That's typically due to lost blood supply, and that can be due to liposuction if it's done in the abdominal flap. Now, you can get away with liposuction of love handles. That's different because that's a different area of blood supply to the tummy flap. So you can get away with liposuction there, but not on the abdominal flap during a tummy tuck.
Gotcha. So what is their option? Can they stage the two, and which would you do first?
Yeah, so I would, if you're going to stage them, do the tummy tuck first. Get rid of the excess skin, get rid of the excess fat. And then if you wish, get that sculpted six-pack look, get that shredded look. Then you could come back later 6 to 8 months, and you could do the VASER Hi-Def liposuction on the anterior abdominal wall.
On top of that, if you want to use that fat for anything.
Yeah, true. Then you could use that fat too, and you could maybe put it in the buttock like BBL, or sometimes the back of the hands, or maybe we're transferring it to the breast, maybe we're transferring it to the face too.
Mm-hmm.
Yeah.
Okay, great. And does insurance ever cover liposuction?
Insurance doesn't cover liposuction. It's deemed as cosmetic. The only indication that I could see that maybe the insurance would cover liposuction is when we're harvesting fat to reconstruct the breast. But that's more for a breast cancer reconstruction. So really, cosmetic liposuction is not covered under insurance.
Okay, got it. So would you say it's not worth it to try, or?
Yeah, I wouldn't even try with insurance because, look, it's not going to be covered.
Uh-huh. And let's talk a little bit about pricing. I know we talked about how the VASER is a little more expensive than traditional.
Yeah. Again, the VASER machine is quite expensive to purchase. The VASER machine does take some education and some training and experience to get used to it on what the machine can and cannot do, and the complications that are associated with that. So because of the machine, it does cost more than traditional liposuction, but it does deliver, in my opinion, far superior results.
Okay, and this is all done under general anesthesia?
Yeah, I perform all these under general anesthesia. I think it's just too painful for the patient under local or IV sedation. I'm very comfortable with my anesthesiologist. You come in, you go completely asleep, you don't feel anything. We do the entire procedure, you wake up and we're done. So there's no pain involved. Whether you're doing under IV or local or twilight anesthesia, you do feel it, and it is painful. So I don't like that. I just do it all under general anesthesia.
Also not optimal results if you can feel the pain and if you might be wanting your doctor to stop, right?
Correct. So if the patient tells the surgeon, stop, the surgeon's going to stop, and we're not going to get equal results on both sides. So we can't get as much done as maybe we would have been able to if the patient was under general anesthesia.
All right, now let's just talk about recovery a little bit.
Yeah, recovery is usually about a week, maybe 10 days, maybe on the outside 2 weeks. So if you have a sitting type job, maybe you're back to work in a week. If you have a very physical job, physically demanding job, maybe we're looking at about 2 weeks. Sort of just depends on the patient. Depends how much we're doing, how much fat we're taking out, how much sculpting we're doing.
Can you do the entire body at once?
No. So it depends on the patient. If they have a lot of fat on the tummy, well, we're going to spend most of the time on the tummy. If they have a little bit of fat throughout their entire body, well, maybe you can go after multiple areas throughout the entire body. Really depends on the patient.
Okay, so what would you not combine as far as body parts that you would lipo?
You could do all body parts, but again, you want to concentrate on areas that bother you the most.
Okay, got it. And what about drains in garments?
Yeah, very good question. So with the drains, as time goes on, I'm putting more and more drains in because I think it leads to a faster recovery. You minimize the incidence of hematomas, collection of blood, seromas, collection of serous fluid. So basically, I think it minimizes your complications, maximizes your results, and leads you to a speedier recovery. So I commonly use the drains now, especially when I'm doing VASER Hi-Def liposuction, the anterior abdominal wall. When I'm doing the arms, I don't use drains, but sometimes we'll use drains on the arms too. And then garments. Garments are very, very important. In my opinion, you should wear your garments minimum 6 weeks after the surgery. And we also have you in a special vest that keeps you nice and flat when we're doing VASER Hi-Def abdomen, and you must wear that for about 3 weeks.
Okay, and why is that so important?
Garments are very important to help that skin to press up against that new surface area. Again, if you imagine the fascia, may layer on top of the muscle, below, a layer of fat, and then the skin floating, I've removed the middle. I've removed the jelly of the peanut butter and jelly sandwich. So basically the vest, the garment, forces that skin down onto that fascia and allows it to stick. If it doesn't, if you're not wearing the garment, there's a free floating area space in there which fluid can accumulate. Swelling, seroma, hematoma, delayed healing, not optimal results. So wear that garment, get a nice flat result, and you'll get really, really happy results.
And what can you combine VASER Hi-Def lipo with?
You can combine it with a lot of other procedures. Perhaps we're doing breast augmentation. Perhaps we're doing an arm reduction. Perhaps we're doing a facelift. So you can combine these with a lot of other plastic surgery procedures.
Okay, great. And can you also do VASER lipo in the neck?
Yeah, you can do VASER lipo in the neck. And you need to be a little careful. There are a lot of vital organs there, your windpipe, your carotid arteries, your jugular veins. So a lot of blood supply. But as long as you stay centrally in the neck region, I think the VASER is safe in the neck.
So what is the scarring like for this procedure?
Yeah, so typically when we're doing VASER Hi-Def abdominal sculpting of the anterior abdominal wall, there are 3 incisions. One in the belly button, you'll never even see that scar. And then 2 incisions in the groin region, and I like to keep that ideally below the bikini line to get that scar completely hidden. And scars are there. They do fade, never completely disappear, but they do fade out very, very well.
Do they tend to be pretty inconspicuous, would you say?
Yeah, almost imperceptible, depending on the healing and everything like that. But with time, scars do mature. It takes about 2 years for the scar to mature. But usually with time, you can barely even see those scars.
How big are the scars?
About the size of a pencil eraser or a grain of rice. Very, very small.
Oh, okay. That's not so bad.
No, not so bad.
For some pretty good results and lots of fat gone.
Yeah, so basically, liposuction is the most commonly performed surgical procedure in the world. More than appendectomies, tonsillectomies, hysterectomies, C-sections, most common procedure in the world. So lots of people are doing it. Very, very good results. It's a very good technology. The surgery definitely works, so I highly suggest it.
All right, lot of lipo.
Lot of lipo.
All right, thanks so much, Dr. Katzen. Good. Where can people find you at?
So we have a website, timothykatzmd.com, and you can give me a call, 310-859-7770. We're all over social media networks, including Instagram and YouTube, etc.
Yeah, if you have any questions, you could DM us at Dr. Katzen MD. All right, thanks so much, and we'll see you next week.
Thanks for having me.
All right.
Bye.